Hi, I'm Sam, the pelvic floor physical therapist at Up and Running Physical Therapy, and today I wanted to speak to you about the pelvic floor. So if you've been keeping up with any of my blogs, then you probably know a little bit more than the average human about what the pelvic floor is, what it does, some dysfunctions of the pelvic floor. But today I wanted to dive in a little bit deeper into the role of the pelvic floor muscles and how they contribute to the functions of the pelvic floor. So just as a little recap, the pelvic floor has many different functions, some of those being to help support the pelvic organs, as a sphincteric role to help maintain continence throughout the day, has a role in sexual function, as well as a role in stability. And so the muscles that make up the pelvic floor are actually divided into three separate layers. So we've got layer 1, which is the most superficial layer, layer 2, and then layer 3, which is the deepest layer and actually makes up the bulk of the support of the pelvic floor. So let's speak about the anatomy, the bony anatomy of the pelvis first. So we've got the spine in the back, and then this is the lowest part of the spine, the coccyx. We've got two hip bones on either side, and they meet in the front to form the pubic symphysis. So the first layer of pelvic floor muscles, I'm actually going to flip this guy around. So this is our anal canal, vaginal canal, and then there should be a little hole there, but that would be where the urethra comes out. So the superficial or outermost layer of the pelvic floor includes the superficial transverse perineal muscle, which attaches to the perineum, which is the area between the vaginal canal and the anus. Then we've got the bulbocavernosus as well as the ischiocavernosus, and both of these two muscles actually play a role in that sexual arousal, orgasm, and clitoral erection. And then the third muscle that we have in this most superficial layer is the external anal sphincter. So layer 2 is a little bit difficult to see on this 2D model, but if we think about a deep layer of fascia kind of on top of that superficial transverse perineal muscle, then we have a deep transverse perineal muscle that is moving in the same orientation. In layer 2, we also have more of the muscles that provide that sphincteric role, including the urethrovaginal sphincter as well as the external urethral sphincter. And then layer 3, if we look at this deepest layer, again, this is our anal canal, vaginal canal, and then urethra would be there. So rectum would sit right here, uterus, and then the bladder. So the deepest layer is collectively known as the levator ani, except one muscle, but we'll get there. And these muscles help to support the pelvic organs, as well as when we're doing a pelvic floor contraction, this is where most of the effort is coming from. So the first muscle that we have is the puborectalis, and this helps our poop stay in. So when this muscle contracts, it increases the colorectal angle to help us maintain continence. And then when we relax and we're trying to go to the bathroom, especially if our knees are up higher than our hips, then this muscle should relax, decrease that colorectal angle so that we can press the bowel movement. The second one that we have is pubovaginalis in a female, and that helps to support the vagina and the uterus. Then we have pubococcygeus, and this is the main contractor when performing a pelvic floor muscle contraction or a Kegel. And then we've got the last muscle in the levator ani series, which is the iliococcygeus. So one more muscle here that is not part of the levator ani, but that is part of the third and deepest layer of the pelvic floor, is this ischiococcygeus muscle. And when both of these muscles work together, they can actually bend forward the coccyx, and when one muscle works at a time, it can side bend the coccyx. And then this muscle also helps to support our SI joint, or our sacroiliac joint, which is in the back. And then the last two muscles that we can see on this diagram, but are actually not part of the pelvic floor, are the obturator internus and the piriformis. And these are external rotators of the hip. So not part of the pelvic floor, but we definitely want to take into consideration hip and spine mobility and strength for optimal functioning of the pelvic floor muscles.